Welcome, everyone. Hi, this is Sarah from QRSMA's Family Support Department. Thank you so much for joining us for today's Summit of Strength presentation on service dogs. We would also like to thank our national presenting sponsors, Biogen, Genentech, as well as our platinum sponsor, Accredo, and supporting sponsor Scholar Rock for their generous support of the 2021 Summit of Strength webinar series. We appreciate all of the questions we received in advance of the webinar, and we'll try to answer many of these during the presentation. You're also able to submit questions throughout the webinar using the questions box, which you'll find located on your GoToWebinar toolbar. Be sure to stay on till the end to participate in the Q&A session as well. Please note that all lines will remain muted during the webinar other than for the speakers. If you have any additional questions after the presentation and Q&A, please contact the QRSMA Family Support Team at familysupport@qrsma.org. We'll be starting today's summit.
Presenter, Caitlin Steinke and Jones, and they will be sharing today with us about service dogs. So welcome, Caitlin and Jones.
Good afternoon, everybody. Thank you so much for joining us, and thank you to the sponsors for supporting this webinar series, and to QRSMA for giving us this opportunity to speak to you all about service dogs. I'm a service dog user since 2012. I'm currently on my second dog. I have gone through 2 different procedures to acquire my service dogs, and my life has changed pretty drastically between the 2 dogs, which is why I ended up going on 2 different routes. So let's first talk about what a service dog is, because in the world of today, there are a lot of different levels of working dogs, including therapy dogs, which work for an able-bodied individual doing invited visits. And at that point, they would go into a nursing home or a school or a library to do reading or something like that and be petted and loved on. Those dogs do not receive protection for public access. There are also facility dogs. And those facility dogs do work such as going 40 hours a week with their handler to maybe a church, or working for a counselor's office, or working for physical therapy or recreational therapy purposes. And then there are service dogs, which are specifically trained to mitigate someone's disability with the task that they provide. And so that's what my dogs do for me. And they are protected by several acts, which we'll talk about later, to go into public spaces, because at that point they are medical equipment. I will let you guys all know that I don't have SMA. I have several friends that I know with SMA, which is how I became involved in this organization. And I often get asked, how disabled do you have to be to qualify for a service dog? And the answer is any level of disability where a symptom affects your activities of daily living. So you could be a stroke survivor, or somebody with a below-knee amputation, or you could be somebody that has incredibly limited finger function and uses a power chair. It doesn't matter the injury level, as long as your dog's task work mitigates the symptoms of your disability. My injury level is I am a T7 paraplegic and full-time wheelchair user with a C6 neck injury that affects my hand function. So both of my dogs have done 80 commands that help me live my life independently and safely, and now confidently. And because you can't see my dog, I'm going to play a video now so that you can see these tasks used within my home and public spaces on a daily basis. So if you could play the video now. you can see, Jones does quite a bit to help me live independently, and he has also helped to decrease my current PCA hours because of the types of things that he does. So in the video, you saw that he can help me remove socks and shoes and pants and gloves, and he can help unzip a vest or a jacket in the winter, and he fetches items from the ground or from a distance. And all of these things make it so that I can live independently and confidently and feel safe. Some of the task work that you didn't see on that video is things like him speaking on command. Service dogs don't talk unless they're asked to. And so my neighbors, and when I arrive at a hotel, I let them know that if my dog is barking or you get a noise complaint, it's because I need help. So if you could please call emergency services or check on me. He does all these tasks not just to make my life easier, but it does keep me safe. My risk of falling is much less because I'm not trying to reach to the floor. I haven't had back issues because I'm not constantly bending at the same part of my spine to pick things up. I do significantly less transfers because if I'm already on the couch or in my bed and I have forgotten to turn off a light in a room or need my EpiPen or medication or water, I can send him to go do those things, which significantly help. And so I'm sure you're all wondering at this point, well, how do you get a Jones? How do you get a Delilah? Where do these dogs come from? So if you could please go to the next slide.
Caitlin, we are on the acquisition slide.
So these are logos of ADI schools around the country, and these ADI schools are accredited internationally, and so they are the Ivy League of service dog schools. They go through rigorous applications to become ADI accredited, and they have to keep that up every several years. And that also leans on their students because their students also are held to a standard of maintaining their dogs in public. So ADI stands for Assistance Dogs International, and that is the governing body for all of these schools and their training standard, and they're guaranteed to be trained ethically, and the dogs are healthy, and they must back their dogs for the lifetime that they work. So these schools are the top of the line, but it's not the only option in the United States. There are also non-accredited schools, and they may be non-accredited because they're small, because they're new, or maybe they're just not interested in being accredited. And those schools do a very lovely job. They may have the same training standards, and I would just encourage you to be very cautious and ask a lot of questions if you're thinking about going to a non-accredited school. Ask a lot of questions because it is your safety, your child's safety, your spouse's safety on the line. And then, of course, in the United States, you do have the option of owner training by yourself or with a trainer. So if you could go to the next slide.
You're on school training versus owner training.
So when thinking about where you would like to apply, it takes a lot of time, and I would always encourage you to look at all of your options. So these are two levels, but within them, there are more levels. So when I'm talking about school training, I'm talking about ADI and non-accredited schools. And when I'm talking about owner training, that is with or without the help of a dog trainer. So the risk versus benefit for these two options is pretty incredible. So the long wait list is what turns a lot of people off from going the fully trained school route. Prior to COVID, the average wait list for a school produced dog like Jones is 18 months to 2 years. At this point in time, that list is up a little longer because obviously they weren't taking clients onto campus. But at the end of that wait time, you are guaranteed to have a dog that will have impeccable manners in public and be accepted because they're not misbehaving, and the dog will do the tasks that you require it to do 100% of the time. The dog is also backed. So if there is a training issue or something changes in your life, you move, you get a new job, you're going to college and transitioning from high school, the school will be there to help you with that transition or to make a determination that it's time to retire your dog. And the dog is also sound and healthy. The schools fail dogs often. School dogs are only made it through the program about 60% of the time. So if a dog has too many ear infections, or they don't pass their x-rays for elbow and hip health, if they have allergies or stomach issues, they don't graduate the program. So the dog that you receive has passed all of those health checks and is guaranteed a nice long working life if taken care of. On the other side, where you're talking about owner training, that means that you need to find a suitable dog from a rescuer or breeder and pay for that dog. You then also have to pay for spaying and neutering and puppy shots and anything that you would need further than that, like ear infections or grooming and veterinary care for the first 18 months to 2 years of this dog's life, not knowing if that's going to be your dog at the end. You will need to pay for all of the training with or without a trainer. So you need to be able to find someone locally that's going to aid you in puppy socialization and basic obedience and task training. And then while you're not going to those classes, you need to get the dog out and experience things positively so that it can go out into the world and do all of the things you need it to do. But at the end, you're not guaranteed that that dog is going to pass anywhere in that 18 months to 2 years that you're training that dog. Something could come up and the dog could be washed and you would have to start all over again. So I'm thinking about the timeline of the schools being so long. At least at the end of that timeline, you're guaranteed something. If you go the owner training route, you could have to restart anywhere along the way. With an owner trained dog, you also don't have any definite and defined support system for the next 10 years of your dog's working life. Small time dog trainers can move on, or their business could close, or they could take another route, or they could move across the country. So find a trainer that you can have a discussion about that with and talk about if they move, if they can still support you, and do they know the ADA laws and all of the things that you're going to need for the lifetime of your dog. So those are just very basic surface differences, and I don't want to discourage anyone from owner training. It's not impossible, but it is incredibly difficult. It is a financial stressor and it is very time consuming. So when you're looking at applying to these schools, look at them like you would be for college, and if they're appropriate, if you have a good fit and good conversations with them, because they will be there for the entire career of your dog. And if you do choose to owner train, just think about all of the speed bumps you're going to have along the way. And sometimes it can be a little discouraging, but just be very thorough in asking your trainer and yourselves what kind of breed is going to be working for you, and do you have the time and the money to spread out over those 2 years to get a dog that is prepared and capable of going everywhere and performing the tasks that you need. Next slide, please.
And responsibilities of ownership.
So this slide is important because we often get asked as a team, does Jones or any service dog get time off? How unfair it is for them to work all the time. But Jones works an on-call position, and he only needs to be fully on when he's vested and in public. And when he's at home, he's on his bed, chewing a bone, playing. He has other dog friends. And it's very important that your working dog is going to live a balanced life. So the responsibility of having this medical equipment is that it does need to be groomed. And are you capable of doing the brushing and the bathing and the nails, or do you need to find someone to do that for you? And are you capable of paying that maintenance on a monthly basis for 10 years? Veterinary costs are also the responsibility of the handler. So yearly shots and maintenance for things like heartworm and fleas and ticks, and any emergencies that could come up are also the responsibility, as well as potentially paying for health insurance every month so that you don't have to make a decision for your dog's well-being based on your financial position at that time. Food is also something that you have to pay for out of pocket, whether you get a dog from a school or start from a puppy. Your dog needs to be fed a decent food. So when you go into the store and you're thinking about having a dog in your life, the bountiful, inexpensive, bottom of the shelf food is not going to be appropriate for a dog that needs to work countless hours a day and have a long and healthy work life. And one of the last and most important responsibilities of being a handler of a service dog is how you're going to exercise and play with them. It's important for their mind and body to stay fit and have time off. That is their stress relief. So if you live in the city or an apartment, do you have a place that you can take them that's fenced in and safe for play? Do you have other dog friends? Do you have a way to play fetch with them, or have someone else help you play fetch if that's not something that's easy for you in your capabilities? So I have one friend who's a quadriplegic and a power chair user, and the dog brings the ball to him and he takes the ball because that's important that the dog brings it back to him. And then he has someone help him throw that ball and he releases the dog to go get it. And so this keeps him in the game, even though he's not necessarily capable of raising his arm over his head and throwing a tennis ball. Bonding with your dog is important. Feeding your dog is important. Even if you are not going to be the one scooping the food into a bowl and putting it on the floor, you being part of that ritual on a daily basis is important for you and your dog. That sometimes is just taking their uniform off and going for a hike, going for a walk somewhere by the water that you enjoy, and just letting them be a dog on a walk for a little while. Next slide, please.
On Protection Acts.
So these are the 3 acts in the United States that protect you as a handler of your dog. So of course the ADA, happy anniversary, we just celebrated 31 years, and that is the act that protects you the most on a daily basis. The Fair Housing Act, which protects you for buying a house and renting, and then the Air Carrier Access Act, which is part of the Department of Transportation and protects you once you enter an airport and will be traveling by air. Next slide, please. So the breakdown of these acts is that the ADA Title I will protect you as an employer would. So when you need to apply for a job or apply to take your dog to work with you, Title I of the ADA is for employment protections. You do not automatically get to bring your dog with you. There is a form that needs to be done. Obviously, if you're working somewhere that food is being handled, that's not going to be the place for your dog. But if you're working in an office environment or you're working in retail or customer service, then you write an accommodation request and then your dog is protected to come to work with you. And Title III would be public accommodation. So that is what keeps me protected to bring whatever working dog I have at that point in my life into restaurants and hotels and grocery stores and shopping and any public space that you would go into with a wheelchair or a walker or crutches. Jones is protected as medical equipment. The Fair Housing Act protects people from discrimination when renting or buying a home. It's a very hard act to explain because renting it is based on how many properties and houses and apartments are within a building and whether or not you are protected there. Of course, in the day and age of Airbnbs and private rentals, it gets a little gray area occasionally. But if you do have any questions about that, I encourage you to send them in so that we can get those answered. The ACAA, or Air Carrier Access Act, is currently changing. So it changed last year. They are doing the best that they can to make an attempt to keep legitimate handlers and dogs safe while traveling by air. So emotional support dogs are no longer allowed to fly based on the ACAA. If a airline chooses to allow them, that is their prerogative. But at this point in time, service dogs are the only dogs to be on planes. And there is some paperwork to be done on each airline per the Department of Transportation. And they're trying to keep you and your dog safe in the air. It is a slight burden to legitimate handlers, but that will protect you if you have a legitimate dog and your dog has good public manners and does a task that mitigates your symptoms as a disabled handler. Next slide, please.
Or your contact information.
So on this slide, you can see our social media information and our email. If you come up with a question later on down the line that you just randomly thought of, or you started looking into schools and a question comes to mind, or you need clarification, please feel free to reach out by message or by email or through Cure SMA. On Jones's Facebook and Instagram, it's quite easy to find other videos of his life and what he does with me and how we travel. There's videos and pictures and lots of educational things on there as well. Service dogs are definitely an Alice in Wonderland rabbit hole, so it's hard to efficiently fit all of the information into one, but I hope that this has been helpful, and I hope that we can educate you a little bit on your journey to find a service dog for yourself or a child, spouse, or even a patient of yours. So thank you so much. I appreciate you all for having me, and thank you again to the sponsors and to Cure SMA for supporting this. And thank you all for being patient through our little bumpy road in the beginning.
Great. Thank you so much, Caitlin and Jones, for really a great and informative presentation today. The video of the task that Jones provides each day was so great to see. So again, thank you so much. And we'll be circling back to you shortly to answer some questions that have come in from our audience. So please note, there is still time to submit your questions in the question box for the Q&A portion that we'll have here shortly. But first, we would like to introduce Rose Domingo Horn, who is representing Biogen, and she'll be sharing their presentation today on antisense oligonucleotides, an overview of the structure and mechanism of nusinersen and spinal muscular atrophy. Rose?
Thank you so much for that introduction. My name is Rose Domingo Horn, and I'm a medical director on the U.S. Medical Affairs team for neuromuscular disorders at Biogen, and I'm very pleased to be able to share our presentation on antisense oligonucleotides with you today. Next slide, please. First, I'd like to share some important safety information with you. Spinraza, nusinersen, is a prescription medicine used to treat spinal muscular atrophy in pediatric and adult patients. An increased risk of bleeding complications has been observed after administration of similar medicines. Your healthcare provider should perform blood tests before you start treatment with Spinraza and before each dose to monitor for signs of these risks. Seek medical attention if unexpected bleeding occurs. An increased risk of kidney damage, including potentially fatal acute inflammation of the kidney, has been observed after administration of similar medicines. Your healthcare provider should perform urine testing before you start treatment with Spinraza and before each dose to monitor for signs of this risk. The most common side effects of Spinraza include lower respiratory infection, fever, constipation, headache, vomiting, back pain, and post-lumbar puncture syndrome. These are not all of the possible side effects of Spinraza. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Before taking Spinraza, tell your healthcare provider if you are pregnant or plan to become pregnant. Please see the full prescribing information. The QR code in the upper right corner on any of the slides in this presentation will link you to the U.S. prescribing information. This information is not intended to replace discussions with your healthcare provider. Next slide, please. In SMA, the SMN1 gene is disrupted and does not produce any SMN protein. The SMN2 gene is nearly identical to the SMN1 gene with one important exception. The SMN2 gene has a change in one of the nucleotides in exon 7 of the gene. A cytosine normally found in SMN1 is changed to a thymine in SMN2. This C to T transition affects the splicing of pre-mRNA, whereby in the majority of mRNA produced, exon 7 is excluded. Because exon 7 is excluded from the SMN2 mRNA, the resulting protein that is made is shorter than normal, unstable, and rapidly degraded. A small percentage of normal SMN protein is produced by the SMN2 gene. Nusinersen targets the pre-mRNA made from the SMN2 gene to modify the splicing process so that exon 7 is included in the final mRNA, thereby enabling more normal full-length SMN protein to be produced. Next slide, please. Antisense oligonucleotides, or ASOs, are short, synthetic, single-stranded nucleic acids bound to a backbone molecule. When genes are expressed, pre-mRNA is produced from DNA. The nucleic acids of the ASO can bind to pre-mRNA with very high specificity by base pairing and can modulate protein expression. The size and chemical characteristics of ASOs prevent blood-brain barrier penetration. As a result, intrathecal administration is used for ASOs targeting cells in the central nervous system. Next slide, please. The base of an ASO will determine the binding that each nucleotide in the ASO has with a pre-mRNA target. In this table, the nusinersen ASO bases are shown across the top row, and the target SMN2 pre-mRNA bases they bind with are shown across the bottom row. Thymine from the ASO binds with adenine in the pre-mRNA. Cytosine binds with guanine, adenine binds with uracil, and guanine binds with cytosine. Because of this specific base pairing, nusinersen binds to a specific sequence in the SMN2 pre-mRNA in the intron downstream of exon 7. Next slide, please. Now let's look at the SMN RNA processing in spinal muscular atrophy more closely. SMN2 pre-mRNA is first made from the transcription of the SMN2 gene, shown here in step 1. During the splicing of the SMN2 pre-mRNA at step 2, exon 7 is excluded from the majority of the mature mRNA transcripts that are then exported from the nucleus at step 3. When this mRNA is made into protein at step 4, the majority of the SMN protein made is shortened, unstable, and rapidly degraded. Without full-length SMN protein, the SMN protein complex that is found in individuals without SMA cannot be formed. Next slide, please. Nusinersen binds to a specific sequence in the intron downstream of exon 7 of the SMN2 pre-mRNA. This binding has been shown to increase exon 7 inclusion in SMN2 mRNA transcripts, shown here in step 2. Exon 7 is now included in the majority of mature mRNA transcripts that are exported out of the nucleus at step 3. Inclusion of exon 7 in the SMN2 mRNA now leads to the production of full-length SMN protein at step 4. This leads to the intended proper functioning of the SMN protein in the cell. Next slide, please. Nusinersen is administered intrathecally by or under the direction of healthcare professionals experienced in performing lumbar punctures. An intrathecal injection involves inserting a needle containing medication into the intrathecal space of the spinal canal. This space contains cerebrospinal fluid, or CSF. In the case of a lumbar puncture, as shown here, the procedure is performed in the lower back or lumbar region, below the lowest point of the spinal cord. Using this intrathecal route of administration, nusinersen is delivered directly to the CSF, which allows the medication to cross the blood-brain barrier and reach the central nervous system. For nusinersen, the recommended dosage is 12 milligrams per administration. It is administered every 4 months after 4 initial loading doses. The first 3 loading doses should be administered at 14-day intervals. The 4th loading dose should be administered 30 days after the 3rd dose, and a maintenance dose should be administered once every 4 months thereafter. Next slide, please. The intrathecal administration of nusinersen into the CSF allows it to be transported from the CSF into the target central nervous system tissue, the spinal cord and brain. In addition to the central nervous system, nusinersen is distributed to peripheral tissues, such as skeletal muscle, liver, and kidney. Nusinersen was shown to increase exon 7 inclusion in SMN2 mRNA and the production of full-length SMN protein in animal models of SMA. Next slide, please. Biogen is committed to evaluating nusinersen across a wide range of patient ages and SMA types, and there are many studies ongoing as a part of our continuing clinical development program. Next slide, please. The first study I'd like to discuss is ENDEAR. This was one of the nusinersen pivotal trials. ENDEAR was a phase 3 double-blind, sham procedure-controlled study of nusinersen in patients with infantile onset SMA. Patients were less than or equal to 7 months of age and had 2 copies of the SMN2 gene, therefore most likely to develop SMA type 1. By sham-controlled, I mean that there was a placebo group. There were 122 infants in ENDEAR. As you can see from the study design, patients were given 4 loading doses of nusinersen, followed by a 12 milligram maintenance dose every 4 months. SHINE is the ongoing open label extension for participants who received nusinersen or placebo. They were transitioned to a blinded loading dose period, followed by a 12 milligram maintenance dose every 4 months. Looking at the primary endpoints, at the final analysis, the median time to death or permanent ventilation was not reached for the treatment group versus 22.6 weeks in the sham group, and 51% of treated patients achieved a Heine-2 motor milestone response compared to 0% in the sham group. Next slide, please. The adverse reactions reported in ENDEAR are generally consistent with those reported in the nusinersen clinical trials. The most common adverse reactions in ENDEAR were lower respiratory infection, constipation, teething, and urinary tract infection. Next slide, please. The next study I'd like to mention is CHERISH. This is another of the nusinersen pivotal trials. CHERISH was a phase 3 double-blind, sham procedure-controlled study of nusinersen in patients with later onset SMA. They were 2 to 12 years of age and most likely to develop SMA type 2 or type 3. There were 126 children in CHERISH. Patients received 3 loading doses of nusinersen, followed by a 12 milligram maintenance dose every 6 months. In the ongoing open-label extension study SHINE, participants have been transitioned to maintenance dosing of 12 milligrams every 4 months. The primary endpoint was the change from baseline in total HFMSE score at 15 months. At the final analysis, an increase by 3.9 points was observed in the treated group, and a decrease by 1 point was seen in the control group. Next slide, please. The adverse reactions reported in CHERISH are generally consistent with those reported in the nusinersen clinical trials. The most common adverse reactions were pyrexia, headache, vomiting, and back pain. Next slide, please. In conclusion, nusinersen is an antisense oligonucleotide developed by Biogen and Ionis Pharmaceuticals. Nusinersen was the first approved treatment for spinal muscular atrophy. Nusinersen is an SMN2-directed ASO indicated for the treatment of SMA in pediatric and adult patients. It binds to a specific sequence in the intron downstream of exon 7 of the SMN2 transcript, thereby increasing exon 7 inclusion in SMN2 mRNA transcripts and enabling the production of full-length SMN protein. Next slide, please. Thank you so much again for your time today and for the opportunity to share this presentation with you.
Thank you so much, Rose. Hi, everyone. This is Sarah again. Before we close out today's Summit of Strength, we're going to go over a few questions that have come in from the community regarding Caitlin's presentation. So the first question is just asking Caitlin if she could elaborate, give more details on the cost of actually getting a service dog.
So the cost is broken down into value, and unfortunately I can't put a value on this piece of medical equipment, but the cost from a school point of view, it ranges between $30,000 and $50,000. Most of the ADI schools are 501c3 nonprofits, and they do not charge for the placement of their dogs. Some of the smaller schools do charge because they don't bring in the same amount of donations, and the cost from a private school is usually between $20,000 and $30,000 out of pocket. Some ADI schools will ask you to help fundraise for them. So in specific needs, and EADS, located in Princeton, Massachusetts, usually asks their clients to help raise around $8,000 for their dog. That doesn't mean that you won't be placed with a dog before you reach that goal, and it doesn't mean that your dog would be taken away if you never met that goal. But it does lend some responsibility to the handler and the actual want for that dog. But most of the schools don't charge, and that is why there is such an incredibly long wait list, because they are raising and training these dogs at no cost to the handlers. Privately, if you're going to acquire and owner train, you have to think about the cost being spread over several years. So you need to break down buying a dog from a breeder or paying a rescue fee, and then the costs of initial veterinary care, and then ongoing training that would go on week to week for those 2 years. And so the approximate cost for an owner trained dog stays around that $20,000 mark, but instead of it being at one specific time, it is spread out over the time of your training.
Wonderful, thank you. Our second question is, do service dogs qualify for a COVID-19 vaccine? Have you heard anything about that?
They do not at this point in time. There is no scientific research that says that they are going to get COVID-19, and if they do get it, that they would spread it. While there are some zoological animals in the feline category that have gotten COVID-19, and some zoos have been trialing vaccines, service dogs are not eligible at this point in time. And no, I have not run into any issues with my service dog being asked if he's vaccinated or being denied because of a COVID risk issue.
Thank you for covering that. And then it looks like we have time for one more question here. Do you know of training? This is a more specific question. Do you know of training to make a specifically 5-year-old Pomeranian into a legitimate service dog? This person says they've heard of a Pomeranian that was trained to help diabetics.
So the size of the dog and the breed of the dog actually does not matter to the ADA, as long as the dog does a task that directly mitigates the handler's disability. So a lot of hearing dogs and alert dogs are smaller for the reason that you want the smallest dog that can do the task. So for hearing disabilities or cardiac alert or diabetes, you don't need the physical task of turning on and off a light switch or carrying a 7-pound bag of groceries or hitting door buttons. So smaller dogs live longer and they cost less to maintain and feed. So if you can have a smaller dog do the job, it is absolutely doable. However, Small dogs are notorious for not having the best manners in public. So it's not an easy feat. It's not something that's easy to do. But if the dog can have appropriate manners to the training standard and it does actually provide a task for its disabled handler, then yes, smaller dogs can absolutely qualify as a legitimate service dog. But it is truly based on, it's not buying a vest, it's not my dog can do the task. Your dog has to do a task that relates to your disability, and the dog has to have public manners. So it can't be lunging and pulling and barking. It can't have accidents. It needs to be able to lay under a restaurant table and not beg for food. It can't get on furniture, so it doesn't. Service dogs ride on the floor of public transportation, on airplanes. They don't sit on restaurant seats. They don't sit on waiting room couches. So as long as the small dog can safely walk around a crowded grocery store and do its job, then it absolutely would qualify.
Thank you so much for that thorough answer. And it looks like that is all that we have time for today. So I just wanted to give another big thank you again to you, Caitlin, as well as Nick and Rose for your time and your presentations today. They were fantastic. And we also want to just say thank you again to everyone who joined in on the webinar. And for all of our attendees, you will be receiving a follow-up email with the survey link. And we would welcome any feedback that you have to share. We also would welcome you to visit our virtual events webpage to see all of our other virtual events that will be coming up in this late summer and early fall. And once again, we're incredibly thankful for the support from our sponsors for making the Summit of Strength webinar series possible. If there's anything that we can do for you, or if you have any additional questions, please email us at familysupport@carisma.org.